little tingle on your lip, you're starting to get a canker sore, use the laser. You don't actually touch anything, you're just waving it over the area. You're killing bacteria, there's no discomfort. It's a pain reliever. That stinging goes away instantly. Faster healing, and of course, you don't need to numb them up for this. Also, if you guys are getting patients that call in that say we can't come in today and have our cleaning or our work done because we have a big canker sore or aphthous ulcer, cold sore, anything like that, you can use this 24, 48 hours. In most cases, 24, 48 hours. I have had a doctor call back and say it's 48 hours, it's not completely gone. So in most cases. Showing you here that you're not actually touching, you're just waving it over. And that is your 48-hour picture.
Wow.
This was done on the show The Doctors. I don't know if anybody saw it, but they did the procedure live. They brought the patient back the next day. It looked like this. These are the actual pictures from that. There is an episode on our website, discusdental.com, where they did that procedure live. So all you hygienists in the room, this one's for you. So this is where I was saying you would add your laser into your already, it's in conjunction with SRP. So laser bacterial reduction, you would do that before, then you do your SRP, and then you do the curettage where you go in each pocket and clean out the diseased tissue. So patients are paying out of pocket for this, but it's very popular.
What are you charging? What are people charging?
Charging about $250 a quad.
For the just additional laser treatment?
Laser treatment, yeah.
Are there codes for insurance?
There is, but a lot of them don't. Yeah. So there is, it's laser-assisted periodontal therapy. It's patented by a different company, so we can't call it that, but it's the same thing. Yeah. So the benefits is it reduces bacteria in the pockets, reduces risk of bacteria entering the blood, no anesthetic, improves LAPT, so that's laser-assisted periodontal therapy, and softens calculus deposits. Benefits, removes diseased epithelium, does not affect the healthy tissue. So that's a huge thing. What else do you know that you can put down in the pocket? It's going to take away diseased tissue and leave healthy tissue alone. There's nothing out there besides lasers. Allows healthy tissue to regenerate. So when you're killing that bacteria, you're taking away the diseased tissue, leaving the healthy tissue, regenerates. Consistent reduction of below 6 millimeter pockets. So we don't have any research on anything above 6 millimeter. It's just not out there. So we can't say that it works. And so we, in all of our presentations, below 6 millimeters, there's research that they go to 2 or 3 millimeters. Beyond that, we don't have any research on it, and no company does. It's highly effective in routine perio maintenance and can be performed by hygienists, and that is correct in your case. Biopsies. Just show you this one. So this one is done with topical because you're removing something completely. You kind of want to give them some comfort, and it's most of the time it's on the cheek or the lips. So you do want to use a topical here. Little to no discomfort, bloodless, and no scarring. So this is 48 hours after. You can see on the bottom picture right here, this is where it was. It's a little bit white still, but you can see that it's not like that at all. And that little bit of black, this picture was done by a dentist just locally in East Bay. This little brown is probably because he used too high of a setting and he wasn't familiar with it yet, but all you do is take some hydrogen peroxide and rub it on there and that's gone. Good things with lasers are you can feel comfortable because it's whatever you're touching, you're cutting away. It's not doing more damage, so you don't have to be scared. Lasers in ortho. Is there any orthodontists in here? Yeah? You ortho too? Oh, just there. So I just want to show you just a little bit of what Dr. Linsky is going to do with her laser. So this is what I was talking about in orthos. So this child, had his braces on. We uncovered that tooth, put a bracket on it, and he was set to go. We didn't have to wait for it to come down. You'd be amazed how many parents want to pay out of pocket for this. So anything you guys see like this, refer them to Dr. Linsky. She can do that for them. So this one, we do want to use topical. You're taking away a lot of tissue, little to no discomfort. It's bloodless, dry feel, immediate bracket bonding. You do it right there, one visit. Saves months to years on treatment time. Safe to use around metal brackets. Now, if you're going to ask me, do general dentists do this procedure? Yes, they do. Sure, Dr. Linsky wants you to refer them, but you guys can also. So here's just a partially impacted cuspid exposure. So you can see the first picture, it's partially impacted. We used the laser, we took it away. And if you guys look at that second picture, that's actually the procedure in process. You can see that skin's coming down, and you might want to note there is no blood there. And then the bracket's bonded. Hyperplasia, probably something else. You guys might even see this too. Just take the laser, cut it away. My niece just had this done. She's 14. She had braces on for 3 years. She just had this procedure done, and this is her pictures. We also get hyperplasia on the inside. 12 days later. Now, a lot of people ask me, why 12 days? It's because the amount of tissue we took away right there. You can see, the picture is hard to see back there. There's a lot of tissue built up there. We took away a lot of it. So we did take the pictures on a 2-week recall. What are you guys using right now for things like gingivectomies, implant recovery? Are you guys referring out? Doctors out there? What are you guys doing? Scalpel? Huh? Scalpel? So scalpel, I get scalpel, electrosurge, or referring out. So if you look at this chart, if you're doing any of the above, you can see that you can do those things with a laser. It's effective on soft tissue removal, any soft tissue, anything. Now our lasers are approved for mouth procedures. People ask me, can we take away skin tags? Whatever you do with your laser on your own time, fine with me. But anything soft tissue, this laser does do. Here I talked about implants, topical, the pain, recession, reduce the swelling, and then the perio. Here's some testimonials. The main thing I get on laser usage, so it's really easy to implement into your office. So don't think, I'll never learn how to use this. You will. It's really, really simple. When you guys try it back there, you'll see that. And then, of course, all laser companies, and ours included, offer training. We offer an 8CE course online or in person. Teaches you everything. Your hygienist can watch it. You guys will learn how to bill for lasers and also just how to use them. Other thing with it is most laser companies out there, ours included, will give you, which is is really cool, a 30-day trial. Our company offers it. So the best thing with that is you do have to pay for it up front, but you have 30 days, money back guarantee. You can try it out, give it to your hygienist, doctor tries it. If you guys don't like it, you send it back. It's huge. I think it's really good. Even if you have no interest in keeping a laser, you guys might want to try it at least in the office. I don't get paid off of it, so I don't care if you return it. But try it. You guys will see that you really like it and it's useful. A lot of doctors don't want to get out of their ways, and when they use the laser, they love it. So this is the little guy I was talking about. Looks like a handpiece. Normally is $6,995. We got you guys a special for being a group. I know this means nothing to most of you, but there's all of the settings for it. It is activated by a foot pedal. We're going to go over that. The other one we have is the SL3. This one is like a laptop. It is corded to charge, and then you can unplug it and move it around. So still portable. It's foot pedal activated wirelessly again. Here's its features. And I have this all printed for you guys in the back, so don't worry about seeing it here. And then there's your special pricing we got for Dr. Linsky's group. All right, so questions. I know that was a lot of information. All of this is in the stuff I gave you guys. The little green booklet that looks like this one. If you guys open that up, it has all your general dentist applications in there. It has the little chart we went over. It has all your power settings, even though the lasers are already preset for you per procedure. It has all of that in there, and then, you know, all the specifics on the lasers themselves. The little booklet here, sorry about your stuff. This little booklet, if you guys read through this, there is a little, at the very end, a little questionnaire. You guys fill that out, and then you send it in. You do get 2 CE credits off of this as well. So that's not for today, but if you guys want to do that in the future, that's in here. And this goes over in detail everything I went over really briefly right here for you guys. So that's all in there. Here's a laser troughing guide I also passed out. That is a basic step-by-step on how to trough with a laser. You could take the laser home today and read that form and you'd be able to do it yourself. It's that simple. So that's in there too. Besides that, we'll go into questions. You guys have any questions?
Are there any concerns with infection control?
No. I'll show you back there that the way the tips are made, they help with that. As far as infection control, because there's heat generated out of it. Any questions, guys? No questions? A silly question? Any questions?